Good day, everyone. I'm Sunaida Alota, inspiring student with 10 years of experience in outpatient department. I'm going to utilize an audiovisual aids as my teaching strategy. Good day, everyone. I'm Sunaida Alota, your training officer, and I'm here to discuss with you an essential topic and a main job-related injury that healthcare workers like us experience, and that is the needle stick injury. For our general objective is to gain the essential knowledge and skills in preventing needle stick and sharp injuries among healthcare personnel. Our specific objectives are the following: to explore the impacts of needle stick and sharp injuries on healthcare workers by listing at least three impacts, to develop measure that the needle stick injury prevention that can be applied to nurses in accordance in hospital guidelines effectively, to perform practices that reduce the risk factors of needle stick injuries in healthcare occupation, to improve proper disposal of needles and sharp safety in the workplace, and to implement the guidelines on the occurrence of needle stick injury among healthcare workers effectively. So, which devices cause the most injuries? According to the International Healthcare Workers Safety Center, it's the disposable syringes comprises 37% compared to the other needle, IV catheter stylet, and scalpel. To begin with our lecture, let's watch a short video for some background information.
Nearly 79.5% of health workers reported they had experienced one or more needle stick injuries in their career. So, what are needle stick injuries? Needle stick injuries are wounds caused by a needle that punctures the skin accidentally.
My question is, have you suffered to a needle stick injury? Well, firstly, we define what is needle stick injury is. A needle stick injury refers to a penetrating wound with an instrument potentially contaminated with another person's body fluid. According to the United States National Institute of Occupational Safety and Health, needle stick injuries are caused by hypodermic needles, blood collection needles, intravenous IV stylets, and needles used to connect parts of IV delivery. We are at high risk of serious infection by bloodborne pathogens. And according to the World Health Organization, needle stick injuries are responsible for global incidence of HIV/AIDS, which comprises the 4.1%, Hep B virus comprises 36.7%, and Hep C virus comprises the 39%. Among healthcare workers for various reasons, as fatigue, careless, stress, and sudden movement of patients. The incidence of needle stick injury varies depending on the work condition, area of the specialization, and workplace environment. Needle stick injuries increases the risk of over 20 types of infection diseases among healthcare workers. According to the Center of Disease Control and Prevention, CDC, and the European Agency for the Safety and Health at Work, or OSHA, there are more than 385,000 and 1 million needle stick cases among hospital health workers in the United States and Europe, respectively. And who is at risk of the needle stick injuries? Those people who are at risk with the sharp and needle stick injuries are the health workers, such as the doctors, nurses, and even the caregiver is at risk of these injuries. And according to the World Health Organization, more than 2 million occupational exposure to sharp injuries occur more than 35 million healthcare workers annually. And who do you think is the most represent the majority reported blood and body fluids exposure? You're right, it's the registered nurses. How can we prevent needle stick injuries? Needle stick injuries can be avoided by the following. Plan safe handling and disposal before any procedure. Use safe and effective needle alternatives when available. Activate the device safety features. Immediately dispose of contaminated needles in OSHA-compliant sharps containers. And lastly, complete bloodborne pathogens training. In addition to that, as a healthcare profession, we can protect yourself from needle injury by reporting the needle stick sharp related injuries and near misses, participating with the training related to infection control, infection prevention, and getting a hepatitis B vaccination as well. You can also protect yourself from needle stick injury by avoiding practices such as walking with the needles without cover, holding the needle with the bare hands, improper disposal of needles, and recapping. Some studies have shown that needle stick injuries are often associated with not using safety engineered sharp or using them incorrectly, and recapping needles. We can utilize one-handed scoop instead of two-handed scoop techniques as shown in the picture. Another way to prevent the needle stick injuries are promptly disposing of used needles in a convenient place and appropriate sharp disposal containers. There are different ways to dispose the syringes in types of container. It can be horizontal, vertical, and in terms of cannula tubing or stylet, it should be rolled over and directly disposed to the puncture-proof container. Another example is a wall-mounted puncture-resistant sharp box. It should not be full and should be discarded when it is 75% full or 3/4 full. The World Health Organization recommends the use of the safety engineered syringes to eliminate or reduce the risk of infection as much as possible for workers and patients. And these are the example of the safety syringes. To prime the pump of our lecture, I'd like to show you some video clip. Let's watch it.
Here are some of the ways needle stick injuries can happen. While injecting a needle into a patient, handling or passing the syringe during or after use, while disposing of used syringes improperly. They can result in hazardous fluids entering the body through the skin, spreading blood-borne diseases like HIV, hepatitis B, and hepatitis C. Adhere to safety protocols and use DispoJet safety needles designed with a special Sharps injury prevention shield to avoid needle stick injuries. To use the DispoJet, you must pull the hinge-based shield back. Push the cover back and press against the hard surface. A click sound will indicate that the needle cover is locked. Then, dispose of the syringe in the Sharps container.
To effectively prevent needle stick injuries, healthcare facilities must provide comprehensive training programs for their staff. This OSHA needles prevention training session aims to educate healthcare workers on safe handling techniques, proper disposal methods for the sharp devices, and use of engineering controls. Employers also need to assess other factors which increases the sharp injury risk, including the fatigue, poor lit environment, staff shortages, and wearing additional PPE, and lack of space. Other measures to reduce the risk of harm are the following: annual review of the data, prevention policy, and evaluation of the user for the safer sharp devices available for all procedures, adopt semi-auto safety mechanism devices, ensure all sharp bins are positioned closely near to the user, and ensure all users are competency trained. And if you experience with the needle stick injuries or exposure to the blood or body fluid of the patient during your course of work, immediately follow these steps. First, don't panic. Then bleed it, wash with soap and water, cover with waterproof dressing, report the incidents to your supervisor and infection control nurse, and immediately seek medical treatment. To sum up, determining the global prevalence, causes of needle stick injuries, familiarizing employees with the OSHA guidelines on minimizing the exposure risk, and regularly updated training that ensure the personnel stay informed with the standard and best practices. Healthcare organization can empower their workforce to take proactive steps toward preventing accidents. I hope you learn from this lecture and kindly support the campaign to stop ticks. Thank you and good day.